Hi guys, this is Azar again, Doctor of Physical Therapy. Today's session is about shoulder issues. First of all, we're going to get familiar with the shoulder structure and shoulder movement. Shoulder movements are 360 degrees, so we go like rotating all the way the shoulder. Some other joints, they cannot do that, but the shoulder joints can. So it's the most mobile joint in our body basically. And all the muscles around it and all the shape of the joint, which is ball and socket, help it to be able to have all kind of motions. The motions of the shoulder joints, if you ever go to the doctor, they're going to check you for all of this. Going forward up, sideways up, going in, internally rotate, going out, externally rotate, going back, extend, and then going in and going out. All of these movements are happening with the different muscles and different mobility of the shoulder. First of all, I wanted to show you a picture of the shoulder structure so you get familiar with the shoulder a little bit. Shoulder is composed of a lot of bones. One of them is the humerus bone, the big long bone of the arm. The other one is our friend, the triangular bone in the back, which we call it shoulder blade or scapula, which has a connection to that long bone of the arm. This one is that curvature that sometimes some of the muscles trap underneath that curvature, which we call rotator cuff problem, which we're going to talk about it later. This one is the clavicular bone or collarbone right here. Okay, and it's most superficial bone you can really see, and you can break it very easily. So these bones are the structure of the shoulder complex, but a lot of muscles are also attached to that. So we're going to talk about the muscles later, but the first muscle that you want to recognize, which is responsible for a lot of injuries, is that little muscle, we call it supraspinatus. Remember that little guy going underneath that curve, the bony curve, which we call it acromion bone, and then can trap underneath that. That's usually what we call rotator cuff syndrome. People go to the doctor said you probably have rotator cuff. Okay, what's rotator cuff? Rotator cuff is the name of a lot of muscles together that they can rotate the joint internally or externally. So rotator cuff by itself is not the injury. Rotator cuff can get tear, can get inflammation, can get trapped underneath that curvature, and the other muscles of rotator cuff also can get problems a lot, but this is the main muscle that usually cause problem. So the shoulder movements are very advanced. So as we said, we have a lot of motions, and that should be there because we need to really do all the work, upwards, downwards, sideways, everything. And usually what bothers a lot of people is when they start going sideways up, a little higher than around 90 degrees, they feel ouch in here. That's very common. That's a supraspinatus, that guy right here. Supraspinatus gets trapped underneath that bony curvature, and we call it painful arch symptom. So if you want to test yourself for rotator cuff, if you feel some like impinging here or some kind of feeling like abnormal here, something's trapping underneath the bone, definitely test yourself. This is the test for you. If you go right here at 90 degrees and start impinging, and go right here, it's bad, but right here it's getting a little better, then you probably have impingement syndrome, which is the same as supraspinatus trapment. If it traps underneath the bone and we keep doing all the overhead work with the weight and stuff, we have a possibility to injure that muscle forever or even tear that muscle. So we really need to be careful and take it seriously if we have some kind of inflammation and impingement in the little muscle, because that small muscle is very important, at the same time is very fragile underneath the bony curvature, and it can get tear very easily. So the most important test that you can do is this one. Another test you can do on yourself is you can bring your hand right here, okay, and then you're gonna push this down and feel out. When you go like this, you feel out in here. And that could be another self-test you can do for yourself to recognize if you have rotator cuff problems. Next session, we're gonna talk about if you have rotator cuff problems, what we can do for ourselves to be able to treat ourselves at home and then prevent it from getting tear and getting worse problems later. Thank you for watching. That was a short video, a starting of the shoulder problems, and we're gonna keep doing on the shoulder. Thank you.